Welcome to IRG's Sports Medicine Update. I'm Tom Hutler along with Shannon O'Kelley, physical therapist and president of Integrated Rehabilitation Group, and our guest, Dr. John Milne, who specializes in emergency medicine and is vice president of medical affairs at Swedish Medical Center, Mill Creek, Issaquah, and Redmond campus.
Dr. Milne, thanks for joining us. The question I have, and I'm sure a lot of people have out there, particularly as a parent, is when should I go to emergency room, and what are the indicators to take a child or a loved one to the emergency department versus just waiting for a physician, your doctor's office, for example?
So the thing that I find with parents and counsel friends and neighbors when they ask me that very question, because it comes up a lot, is really trust your gut. That I find that most mothers really understand, is my child sick? How sick are they? They're not behaving the way I would normally expect them to, or this is an injury that seems really serious, whether it's there's a lot of blood involved or if there's an obvious deformity to an arm that suggests a broken bone or something like that. Parents are really usually pretty in tune with their kids as far as when they need to receive that highest level of immediate care right then, as opposed to waiting to a doctor's office visit. The question that oftentimes comes up, though, in the middle of that is, should I go to the emergency department, or should I go to an urgent care, or should I try and make an appointment with my physician's office? And the thing I usually tell parents is most of us understand kind of intuitively what kind of stuff your primary care physician can do in the office in terms of kind of coughs and colds and routine sort of medical sorts of illnesses. And we understand, major trauma, you're going to want to end up in after a car crash or something like that, usually in the ER. But it's that in between, where do I go? And what I tell people is, think about the things that you normally see your doctor for a clinic type of a visit, a fever or something like that. And those are things that are very appropriate for an urgent care. And urgent care is in many ways very much like your primary care physician, just open extended hours, a little bit more accessibility. But if that child is really acutely ill, they're vomiting and you can't keep anything down, you think they might need an IV, or they seem to be just more sick than what you'd be comfortable with in your primary care physician's office, that's when the ER is a very appropriate place to take them.
Excellent points. Hey, we're seeing a lot of changes in the healthcare delivery system, and I know Tom mentioned you work at Swedish. Tell us about emergency departments hospital-based emergency departments and these freestanding emergency departments that we're starting to see in kind of the Puget Sound region.
Great question. Swedish was really the pioneer with regard to freestanding emergency departments here in the King County market, opening our first one of those in 2005, and have subsequently evolved that facility into our Issaquah-based hospital, but subsequently have built two more facilities in Redmond off of Union Hill Road, and then also in Mill Creek off of 128th Street as freestanding emergency department facilities. So the question is, what's the difference between a freestanding emergency department versus a hospital-based emergency department versus an urgent care type clinic type of a situation? And what I tell people usually is that a freestanding emergency department is if I took and cut out the types of services that you'd get in the ER itself out of a hospital and put it at a freestanding location. So you're able to get full x-rays, including CT scans and MRIs and ultrasounds at that freestanding emergency department. It's being staffed by board-certified emergency physicians and nurses who are trained in emergency medicine with a high degree of expertise to do even critical care level intubations and chest tubes and care for the sickest of the sick. The difference is we don't have an operating room right there. You don't have an ICU right there. So if a patient needs to be admitted to the hospital from a freestanding emergency department, those patients are usually sent then down to a hospital either downtown or one of the other regional hospitals where they have beds. But if we look at the statistics, even in a hospital-based emergency department, even at the highest level of acuity, such as our First Hill campus in downtown Seattle, where we see the sickest of the sick coming in by ambulance, even in that scenario, usually only 20% of the patients who come to an emergency department end up needing to be admitted to the hospital. So the freestanding emergency department is a very good option for patients who are in that other 80%, the vast majority of patients who really do need the emergency level of care. They're getting IVs. They're needing more significant diagnostic testing that only an emergency department can offer. But ultimately, after treatment, they're allowed to be able to go home. And that's really the big difference between an urgent care clinic type of a situation is the clinic is not usually staffed by board-certified emergency physicians. There are oftentimes nurse practitioners or PAs might be in an urgent care type of a clinic, and then they usually don't have the diagnostic tools in terms of all of the laboratory tests or all of the imaging studies, such as a CT scanner, available to them if they needed it. And so, again, it's very much like a doctor's office clinic type of environment. And so the types of cases that you would go and see your primary care physician for if it were a Monday afternoon, but now it's a Sunday morning, that type of a scenario is the one where you probably would want to go to an urgent care instead of an ER. But if you're really sick, throwing up, can't keep anything down, needing IV medications or IV fluids, those are the things that a freestanding ED is the perfect location for you.
So what I'm hearing you saying basically is these freestanding ED departments are really set up very, very comprehensively. I mean, diagnostic-wise, I mean, you can see everything. And if a patient needs to be admitted, and you mentioned only 20% do, you just transport them to the hospital then.
That's correct. And even actually, because we're not receiving all of the ambulances, the admission rate out of a freestanding emergency department is lower than our hospital-based emergency department. But all of these freestanding emergency departments that are run through the Swedish system, at least, are accredited through the Joint Commission, which is the same regulatory body that inspects all of our other facilities and certifies all of our other facilities. And like I said, it's staffed with physicians who oftentimes are the same ones who are working at the hospital-based facilities. So the level of care that you're able to get in the emergency department at a freestanding ED in terms of the quality and the comprehensive ability of them to be able to provide service is the same. But because it's not in a hospital-based, oftentimes it's more efficient, it's faster to get yourself through, assuming you're in and out and just needing the ER and not needing the larger hospital-based resources.
You mentioned something I want to follow up on because I want people to understand. When you say board-certified emergency room physician, explain that educational process for those doctors.
Great question. So somebody who is a physician has gone through 4 years of undergraduate training and has a bachelor's degree from the University of Washington or someplace like that. And then they've done 4 more years of medical school is a really a generalist educational process. But then once you've completed medical school, and all physicians have completed medical school, that's when a physician picks their specialty and goes off and does a residency program. And we now have a new residency program at the University of Washington in emergency medicine that's actually 4 years of additional training beyond medical school in just emergency medicine. And so those physicians are being trained at Harborview with the sickest of the sick in terms of being able to be specialists in emergency care and how do you take care of patients with emergency care versus somebody who is going to become a specialist in pediatrics will do 3 years of a pediatric residency and become board certified in pediatrics at the end of that. I've done an emergency medicine residency, additional training, and then become board certified in emergency medicine at the end of that. And so as you look at physicians and their qualifications, you sometimes meet kind of semi-retired old general surgeon who's board certified in surgery but might be working the ER kind of in a semi-retirement mode, or a family practitioner who hasn't practiced in a family practice clinic in many years that might be working in an emergency department. Usually those are oftentimes found in more rural sorts of communities where you've got an old-time country doc who's doing a little bit of everything, but not as often in the urban areas like Seattle and Tacoma, where most of the physicians who practice in emergency departments are board certified in that specialty.
Okay, so one of the things that you often hear about is wait times in the emergency departments. I mean, that comes up all the time in healthcare. At Swedish, are you folks committed to a certain time period for waits? with your patients?
So in our departments that my group staffs on the east side, so in Issaquah, Redmond, and Mill Creek, we're very focused on a no-wait philosophy, meaning that we don't have patients waiting in the waiting room. They're brought right back to a treatment room, and treatment is initiated right away, rather than queuing them up into triage and queuing them up into the waiting room. And it's just a philosophical process, and we work really hard to optimize the efficiency of our departments to allow for that.
Well, Dr. Milne, that's great information. Thank you for your time.
If you would like more information on this topic, as well as how to contact Dr. John Milne, go to irgpt.com and click on the Health Media tab, or go to Integrated Rehabilitation Group's Facebook page.